Good afternoon. My name is Corinna and I'm here at the U.S. Conference on AIDS in Washington, D.C. this afternoon. One of the big themes of this conference is HIV and hepatitis C co-infection, and many people are unaware that co-infection of people with HIV and hepatitis C, about 1 out of every 5 people with HIV is co-infected. That high rate of co-infection means that people with HIV develop severe liver disease. It's one of the leading causes of death among people with HIV. And it's one of the reasons why we're here to raise awareness at the U.S. Conference on AIDS, because there's a lot that we can do around HIV and hepatitis C co-infection. That's why I'm excited to be joined here today by my friend Peter McLoyd from the Chicago Core Center. He has some personal experience both as a patient as well as working with people with HIV and hepatitis C co-infection. So, Peter, can you tell us a little bit about your experience with HIV and hepatitis C?
Sure. First of all, as you said, I work at the Core Center, but I was originally introduced to the Core Center after being diagnosed with HIV in 1997. A couple of years into treatment, I found out that I also had hepatitis C. I had first heard about hepatitis C 20 years before that when I was in the emergency room and was getting treatment. And they told me that I had a form of hepatitis C, but it was non-A, non-B.
Okay. Boy, we've come a long way since then. So did you take the treatments that they used to have for hepatitis C?
I did. I originally took the pegylated interferon. I was on that treatment for a year, and I feel comfortable saying that was probably one of the roughest years of my life. The medications caused some severe side effects, and I literally didn't have a weekend or any type of social life during that year. I was lucky that I was recently married, and my wife is a nurse who works does HIV, hepatitis C work, so she was a great support for me during that time.
So those treatments, it sounds like from your story, that treatment didn't work for you.
It did not work. It was very disappointing. I was told to just continue to do everything I could to keep my liver healthy. And then a few years back, these direct-acting antivirals came out, and I took a treatment. I was on a treatment for 6 months. I initially was told that the treatment worked, that I was virally suppressed, but after returning to the doctor, I found out that the hepatitis had bounced back.
Wow. So if you could compare the old treatment and your experience with that compared to these new all-oral treatments that we have, how would you compare those?
There's no comparison. There's no comparison at all. First of all, even though I failed that second round of treatment, I started again a year ago and completed treatment, and I am officially cured of hepatitis C now. The other big difference is that there was minimum side effects. I mean, I literally was able to work every day. I could feel my level of energy increasing as I went through the treatment, and it has sustained me till this day.
That's amazing. Congratulations on getting cured.
Thank you.
That's got to be also a big difference between your work in HIV compared to hepatitis C, to be able to yourself achieve a cure, but also to help other people.
Absolutely. And I mean, that's one of the selling points of when you're talking to somebody living with hepatitis C, whether they're co-infected or not, is the fact that this is a cure. You can literally take this medication, depending upon your doctor's recommendations, for 8 to 10 weeks or maybe longer. But at the end of it, over 90% of people are officially cured. Well,
so now that you're cured, you can say that. Do you experience anything different? I mean, if you feel better, or if no different at all?
No, I mean, I feel better. Certainly, during this whole time of living with HIV and hepatitis C, I was plagued by chronic fatigue. Right. And I never knew what was causing the fatigue. Was it the HIV? Was it the hepatitis C? But certainly, after being cured of the hepatitis C, I can attribute much of that fatigue and feeling tired all the time to the hepatitis C.
So a lot of people with chronic hepatitis C I think, don't even recognize that they have any symptoms, even though they may have some fatigue, they may have some trouble thinking. I hear that often from people, that they have some symptoms, but they can't really pinpoint them.
Right.
But after treatment, then I think maybe it becomes a little bit more clear as to what those benefits actually are.
Yeah, I mean, hepatitis C, I think it's sometimes referred to as the silent disease.
Yeah.
I mean, I lived with it for 40 years. Could really never attribute any particular thing to having the infection. But I think certainly after being cured, I know now that I feel totally different. I feel a lot better. And I mean, it's not only good just for me physically, but I think it's been good for me mentally, because I spent a lot of time worrying that here I am doing really great with the HIV, but I'm faced with hepatitis C, and is the hepatitis C going to eventually be the thing that gets me?
Wow. Well, that's a pretty powerful story. I also know that you're doing some work on the advocacy side, and being, the kind of getting more engaged in work on hepatitis C kind of at the community level.
Yeah.
Can you talk about that?
Yeah, well, my work at the Core Center is really around the advocacy part, and mostly it was, for 10 years, it was around HIV advocacy and supporting policy initiatives and things like that. But, after having this experience with the hepatitis C and knowing how difficult it is for people to be treated, I really began to be able to focus more of my work around hepatitis C, specifically around increasing access to these medications for people living with co-infection, but people living with just hepatitis C. So I partnered with physicians, staff from the AIDS Foundation of Chicago, in Chicago, to talk to people at the state legislature and at the Department of Health Services in Illinois about increasing access for people.
That's awesome. So you're doing that great work in Chicago. I think people who are viewing, we'd love to know where you are and where you're doing work on viral hepatitis. So type it in on the comments. Tell us where you're at. We'll be circling back with you. And if you have questions, please also send those. We'll get to those as we continue our discussion here today. Okay. So I think you were talking about partnerships, and that's one of the main kind of things that we really need to do more of, I think, in viral hepatitis.
Right.
And in our office, we have the National Viral Hepatitis Action Plan for 2017 through 2020. That action plan, just released this year, really provides a framework and kind of a strategic plan for the nation.
Yes.
It was developed by 20 or more federal agencies, but really what we're looking at is a plan that includes everybody. Everybody from groups like yourself working in clinics and cities, to folks in substance abuse treatment, in jails and prisons, people doing outreach. There's so many ways that we can affect change in this field because we have these amazing new treatments. It's really a time of hope and a time of excitement for those of us working in the field. And I'd love to hear about what folks are doing, but also encourage people to go to hhs.gov/hepatitis and check out our National Viral Hepatitis Action Plan, because we identify priority strategies, we identify priority populations, and we try to give people at least a place to start when they're thinking about what kinds of viral hepatitis activities would be right for their organization, or, like you were talking about, partnerships that they may need to establish in order to do the work that they need to do and better serve the folks that they're serving that are at risk for living with HIV, with viral hepatitis. Can you tell me a little more about what you do with the patients and your program at the Core Center?
Yeah, I mean, right now we started off as more of a focus on HIV. We quickly began a hepatitis clinic.
Okay.
And initially there was not much that the physicians can do, but to track patients and do health education. Now, today, we can actually cure people. I mean, one of the challenges has been that most of our patients are have Medicaid, and there was really some pretty strict requirements on the state Medicaid program in Illinois about when physicians could prescribe. We were fortunate that a year ago, the Illinois Department of Public Health did a pilot project where 200 people living with co-infection could be treated, and that was very successful. So 200 people in Illinois were cured because of the state's ADAP program, AIDS Drug Assistance Program. And just last week, the state announced that they're going to be opening up that pilot for all eligible people who are co-infected in Illinois to be treated. So that's huge. And that's a lot of that is a result of advocacy efforts from both our physicians, our patients, and again, AIDS Foundation of Chicago. So it really takes these collaborations to make things happen.
I couldn't agree more. We're excited at HHS to have federal partners from CDC, from the Health Services and Resources Administration that manages all those health centers, FDA, and many others that are just right on board with us every step of the way. We have great support there. But the message really is, in this time where we have these curative treatments, that we can do more because we have the tools.
We have the tools.
Unlike in the past where we didn't have a cure for hepatitis C, unlike in some ways HIV where we don't have a cure yet.
Right.
I think this is an incredible time where if we focus our work and be strategic and use those strategies, and that's, again, what the action plan kind of does is to give people a direction so that we're all pulling in that same direction, because that's how we're going to be able to make the most difference.
Yeah.
And so I understand we've got folks from Brooklyn, folks online from Chicago, and I encourage you again to tell us where you're watching from. This is Facebook Live with HIV.gov. At a session here today earlier, we actually talked about the Secretary's Minority AIDS Initiative Fund and a couple of programs that they are supporting to really understand better what's going to be effective in terms of helping people with HIV and Hep C co-infection to get the treatment and the cure for Hep C, and establishing those best practices. And I know that in Chicago, Core Center is being held up as a great practice, as a program that should be replicated and get more people into care and treatment.
Right.
Go
Yeah,
ahead.
I mean, I'm very proud of the work that the Core Center has done over the last 20 years for people living with HIV as well as people with hepatitis C. I think that one of the things that's very encouraging for me is that we have a couple of physicians in our hepatitis clinic, Dr. Torian Adeyemi and Greg Hune, who are not just providers and prescribers, but very, very good advocates for people. And Dr. Adeyemi in particular has testified at the state level about the need for increasing access to these drugs. So we're lucky to have physician advocates as well.
Physicians play a huge role, and one of the things we want to do is to make sure that all providers who are taking care of people with HIV understand that the new treatments actually cure 9 out of 10, or even in some cases more people with co-infection. So we have this opportunity, and I think a lot of providers are hesitant, especially when they're working with the HIV patients, because of those drug-drug interactions, because it seems so complicated, and because you mentioned earlier, we know there are some restrictions, and there may be some extra processes that those providers need to go through in order to get their patients the care and treatment that they need.
That's right. I mean, initially some of the restrictions at the state level was regardless of how sick you were or how long you'd had hepatitis C. I think that me and other advocates and even some of our physicians try to make the point that you know, the sooner you treat people, the better it's going to be for them as an individual.
Right.
I'm not a cost expert, but I would think that if you stop people, prevent people from having to go be hospitalized or get on liver transplant, that's going to be cost effective. So there's no real good reason not to treat everybody in the United States that's living with hepatitis C.
Wow, you took those words right out of my mouth. So the other thing that we're seeing in the hepatitis C kind of realm is this real increase, like 300% increase between 2010 and 2015 in new hepatitis C infections. That's primarily being driven by the opioid epidemic, by the increase in people who start injecting drugs. What are some of the things that people can do to prevent hepatitis C in the first place?
Well, I think for one thing, you know, when you see a physician, talk to your physician about being tested. The only way you're going to know for sure if you have hepatitis C is to get a test. And if you find out that if your test come back positive, then talking to your physicians about treatment options. Initially, when these new medications came out, you know, the costs were extremely high. As more options have came out, the costs have gone down. Still high, but you know, we're doing some work on the advocacy side on that. But yeah, you know, just talk to your physician. We feel that, you know, everybody should be routinely tested for hepatitis C, as they are with HIV. But yeah, those are some of the main points.
One of the things about hepatitis C testing, just want to put a plug in here. Some people get the antibody test, but they don't go and get the second test that you need to be confirmed to have that infection. So hepatitis C testing is usually a two-step process, and we want to make sure that everybody's getting the best quality care, getting that second test so they know whether they need to get treated or be considered for treatment at least for their hepatitis C.
Yeah, absolutely. Confirmation tests are critical, and that's what, you know, if it unfortunately comes back positive, that's when the conversations begin about your treatment options.
So I think there are a lot of things that we can do. This is a time where we have a real opportunity to lay the foundation, to get our strategies in line, to find our partners, and to work toward laying that foundation where we can achieve hepatitis C elimination in the United States. That's why we're here today at the U.S. Conference on AIDS in Washington, D.C. And I want to thank you, Peter, so much for joining me here today. It's been a real pleasure talking with you.
Well, thank you for the invitation, Corinna, and thanks for HIV.gov/hepatitis C, hepatitis, for all the work that you're doing there.